Although heart disease is complex, having many different risk factors and causes, there are 5 foods that I recommend to address many of the imbalances that underlie and drive arterial disease. Some of these factors include oxidation, inflammation, endothelial dysfunction, and low nitric oxide status. These important foods, especially when combined with a heart-healthy nutritional protocol, really good stress management, daily fitness, optimal sleep, avoidance of excess saturated fat and processed foods, avoidance of excess sugar, and overall proper management of cardiovascular risk factors can really help promote arterial health by several different mechanisms. Not only do these foods help prevent arterial disease, they also provide protection against the very diseases that increase the risk of heart disease, like high cholesterol, diabetes, and obesity. I'm Dr. Ayo Bankole, and I'm a licensed and practicing naturopathic doctor, and I focus on regenerative therapies and root cause analysis and treatment and prevention of hypertension, abnormal cholesterol, and heart disease, especially as it relates to lifestyle and the environment. These foods conveniently are not exotic. We don't need to look around the world for them. They're right in our local grocery stores. But here's the thing. We just want to eat them regularly so they're a normal fixture in our everyday diet. That way, they can ensure that they have a positive impact on our health. So here are these 5 foods and why they're so helpful. The first superfood, pomegranate. It's super high in polyphenols, namely ones known as puniglycans. The polyphenols in pomegranate are great for protecting against oxidation of LDL cholesterol. They also lower LDL cholesterol and they lower blood pressure as well. And studies in pomegranate show consuming pomegranate decreases the thickness of the carotid artery intima media, and it helps to stabilize plaque. And a very unique feature of pomegranate is that it upregulates an enzyme known as PON1 or peroxidase 1. Increased activity of peroxidase 1 is known to improve the functioning of HDL. Essentially, it helps HDL grab more LDL for metabolism. This enzyme is also important because it detoxifies from organophosphate pesticides. That is the most widely applied pesticide in America. Lastly, low levels of PON1 have been correlated with increased severity of cardiovascular disease. So that's why we want to seek out more pomegranate. I recommend a few handfuls of kernels daily or drinking 3 ounces of juice. But if you have juice, make sure you have it with a meal. The next potent heart protector is green tea. It's super high in epigallocatechin gallate or EGCG. And these catechins provide strong antioxidant protection. They help lower inflammatory markers, and studies show that they even help lower blood pressure, LDL cholesterol, and triglycerides. In fact, one Japanese study showed higher green tea drinking was correlated with less coronary artery disease. I recommend drinking a couple cups of green tea in the early part of the day. And if you happen to be sensitive to caffeine, throw off the first steep, then re-steep the same bag, and that way you'll get more catechins and a lot less caffeine. Next is curcumin. From the turmeric root is well known in curries, and it's perhaps nature's most powerful anti-inflammatory. That's because the root contains high amounts of a class of polyphenols known as curcuminoids. Curcumin also has powerful antioxidant capacity, protecting the LDL against oxidation, and has potent antimicrobial properties. And that helps to suppress the growth of pathogens in the arterial system. That's important because of the link established between pathogens, acute or chronic, and cardiovascular disease. Curcumin also has anti-cancer properties. Curcumin combats inflammation in the arteries, and it helps to lower fibrinogen and inhibits platelet activation. Those 2 actions combined help decrease the increased rate of clotting. As for cholesterol, curcumin has been studied to increase HDL cholesterol and to lower both LDL and triglycerides. Curcumin improves endothelial function. Curcumin improves insulin resistance. Additionally, curcumin helps to lower unhealthy uric acid levels. Elevated uric acid levels are a risk factor for heart disease and a sign of kidney dysfunction. So these reasons make curcumin very valuable for protecting the arteries. Use curcumin liberally in cooking and or supplement with curcumin. The next cardiovascular protecting food are nuts. Nuts are not only a healthy part of the diet, not just because they contain protein and healthy fat profiles and fiber, but the consumption of nuts is actually associated with decreased rates of obesity and metabolic syndrome, which are both risk factors for heart disease. The Adventist Health Study showed that nut consumption decreased the rate of fatal heart attacks by 73% and non-fatal heart attacks by 74%. And researchers estimated that eating just 30 grams could decrease death from cardiovascular disease by 8.3%, and that's about the equivalent of just a handful of nuts. Another study showed specifically eating walnuts improved endothelial function. That's important because heart disease begins with dysfunction and damage to the endothelial layer. That's the innermost line of the arteries. Also, walnuts are high in quercetin, which provides antioxidant properties and has been studied to independently help lower blood pressure in individuals with hypertension. Eat about a handful of nuts daily. And the fifth and final food on this list of powerful foods to eat to protect the cardiovascular system is olive oil. Extra virgin olive oil is rich in heart-healthy monounsaturated fats like oleic acid and is especially high in healthy polyphenols. EVO promotes vasodilation and it decreases arterial inflammation by increasing the availability of nitric oxide. EVO also decreases inflammation as measured by blood levels of C-reactive protein. EVO lowers LDL cholesterol. Olive oil also decreases the rates of primary heart disease risk factors like hypertension, obesity, and type 2 diabetes. A Harvard study in fact showed that olive oil consumption decreased rates of stroke by 15% and decreased rates of heart disease by 21%. Then there's matrix metalloproteinases. They're a class of degradation enzymes that are associated with heart disease and insulin resistance, along with increased cardiovascular mortality. Well, would you know that olive oil polyphenols have been shown to inhibit the activity of matrix metalloproteinase activity, along with the inflammation and the arterial disease that they generate. Finally, extra virgin olive oil increases the activity of the PON1 or peroxidase 1 enzyme, just like pomegranate. So eat at least 1 to 2 tablespoons daily, consume in your cooking or as a base for your salad dressings, or even place it in your smoothie. So the regular presence of these 5 foods, pomegranate, green tea, nuts, curcumin, and extra virgin olive oil, help work against many of the underlying imbalances that drive heart disease, such as oxidation, inflammation, and low nitric oxide status, and endothelial dysfunction. Not only that, but these 5 foods also help protect against and can participate in treating primary heart disease risk factors like high cholesterol, high blood pressure, and diabetes. And since heart disease continues to rank as the #1 cause of mortality, not just in the US, but worldwide, be sure to make these foods a regular fixture in your diet. For more tips on heart-related health, like and subscribe, and look out for my next video.